that we vitally need in the city to care for our employees. And now we're on YouTube. So at 3:01, do we have a Ms. Cook or whoever's counting?
I believe we have a quorum. The mayor has not joined yet.
I think he's going to be a little bit late. I talked to him a little while ago. Is
Okay.
El Chapo with us? I don't see her.
She is not on yet.
Okay, so we have Councilmember Brady and Sheila. How about Councilmember Gregory? Oh yeah, I see Councilmember Gregory with his beautiful outdoor view.
They're in the garden.
Why don't we get started, and hopefully El Chapo will be joining us soon. I will open with a prayer. Please allow me to do so. Lord, we thank you that today is a day that you have made and that we are here to serve you and our citizens and the employees of our city. We hope that we will have a conversation that's pleasing and one that moves the ball forward. In your name we pray. Amen.
Amen.
And now, before we take up our full agenda, and I realize it's very full, so we'll try to make very efficient use of our time. But I would like to introduce a document that I sent to all of the Human Resources Committee members, as well as Director Cross yesterday morning and Director O'Brien yesterday morning. It's a list of concerns that was delivered to the Human Resources Committee by two gentlemen that are known to the city well as former council members. And basically they have been acting as facilitators for I think two, and maybe there's going to be a third conversation among employees of the city who work in our environmental services collection teams. And so I would like to entertain a motion to amend our agenda to be able to receive this document for the record, and then call on, I think our ES manager, Matt Altop, wants to say a few words and to provide additional information to us. And then I would like the motion to say that we'll put the document forward to the Human Resources Director and to our Public Services Director for resolution. So could anyone make that motion?
Madam Chairman, which document is it?
It's a document that was a single page that I sent directly to us yesterday morning, sometime around 8:30. The gist of it was actually quoted in the Post and Courier. There was a commentary on the op-ed page, so it's part of your packet.
Okay, I'm pretty familiar with it, and
I wasn't planning on entertaining any discussion, just putting it on the record and letting Mr. Altop speak, and then just having the motion include that we're going to forward it over to the two directors for resolution.
The only reason why I'm hesitant is because I don't think the two outside people followed the appropriate protocol, because they've been working on this now for a while, and you may not be aware, but 3 council members refused to attend any of those Zoom meetings because protocols were not being followed, and we thought that our employees were being misled.
Well, I personally appreciate that, Councilmember Gregory. I do feel like this is a way to bring all of that, if it's important, to bring the part of the resolution process. I think we're just acting as a conduit, which we normally do as the Human Resources Committee. Today we have 3 items on our agenda as an example from the Women's Commission. In a similar way, they're making recommendations to us for us to consider, and then we will put them forward to the appropriate resolving bodies. So I do feel responsible to do that, and I hope that someone will make the motion and we can take.
So moved.
Second.
So moved.
All right, is there any other discussion about just putting this on the record and then letting Mr. Altop have a minute and then we'll go on?
Carol,
Yes, Councilmember Del Chapo.
I apologize. I lost track of time. I am here now, so please accept my apologies, everyone.
Great. Okay, good. So all in favor of taking that little approach with the agenda?
Aye.
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 You're muted,
You're
Carol.
muted.
You're muted,
Sorry.
Carol.
I'm calling on Mr. Altop to give us a couple of information items.
Okay, so according to that document that you sent out, a lot of the stuff that was in that document have already been or is already in the process of being resolved. A lot of that stuff had already been resolved, so it was a shock to us as far as what came out in the paper. You know, PPE, for example, all that stuff is on hand, has always been on hand, from safety glasses to gloves, to any other safety concerns that they need and have asked for, we provided. COVID, we have all the stuff there, following CDC guidelines and working with Heather and their group a bunch to make sure, and Rick Markowitz's group to make sure everything's being followed there. The equipment, we've had 18 pieces of equipment the last 3 years, so that equipment is being updated yearly. And as far as the supervisors go, you know, we have, including myself, there's 5 of us, and 4 of them are African-American and 2 of them are female. So as far as the racism part of that goes, you know, that's, I want to say hearsay because that's not true. It's inaccurate.
Madam Chairman.
Thank you. Yes, Councilmember.
Yes. Just for the record, the chairman of Public Works sent in a letter stating that he would not participate in it. And as a result, he also articulated some of the stuff that you just articulated, Matt, in terms of what the city is already doing and has been doing. And that we were a little taken back because we have an established rapport with many of the employees in environmental services, and they have never been hesitant to call us on the phone with an issue. So I found this one to be a bit unusual. I am a bit hesitant when quote unquote outsiders come into our realm, and it makes it appear as though they're rabble rousing, and I'm a little concerned about that because we do have protocols in place, as you know, when employees have grievances or problems or issues. The employment handbook is very clear that they should first lodge those issues with their immediate supervisor and take it up the ranks. That was not done in this case. It was pretty disappointing to me how it was handled because I do know many of the environmental services workers, and they tend to be not hesitant to call any of us with an issue. So I was just taken back at the approach that has been used. And while these 2 people are former city council members, I think that they went and should know better that we do have protocols in place and that they should have really counseled our employees accordingly.
Thank you, Councilmember Gregory. I do believe that all of what you just said will be part of the resolution that is conducted as we just send this forward. So I'd like to go on to
Jackson, Ms. Jackson,
minutes.
Councilmember Jackson. Hello, Ms. Jackson.
Yes, I'm sorry.
This is Tom O'Brien. If I
Oh,
may,
thank you, Mr. O'Brien.
I'd like to add one thing, if I may. there were a couple other issues that were in the paper in that article. One was the $15 minimum wage, and 56 of the 65 employees in environmental services make above the $15. I just wanted to make that for the committee also.
Very good to have on the record.
And the other thing, as far as the COVID-19 hazard pay, you know, the city of North Charleston, our sister to the north, very early in this process, made some adjustments to allow that. And as we're all aware, they've had a recent another article where they're talking about layoffs and furloughs of up to 200 employees. Our mayor and our financial CFO, Amy Wharton, are working diligently to make sure those things don't happen. And our police and fire and environmental service workers, who just like everybody in the cities, worked very hard during the COVID-19. It's just not an option right now due to budget items. So, and the last thing I'd like to say is, after getting the article yesterday morning, Matt and myself met with a gentleman, I don't want to make any names, but who is one of the kind of the vocal leaders of the environmental services. We sat down with him and a couple of our supervisors yesterday, went over everything, and I think we had a very excellent meeting. In the end of it, he told us he was not even sure he would even participate in the other call tonight after listening down with us. So we're, as Matt said, we're always ready. As Mr. Gregory, Councilmember Gregory said, anytime employees have any concerns or issues, and one thing we promised the employee yesterday, he said, well, we haven't had a meeting. I said, well, as a result of COVID, we could not have a meeting, but what we promised them is next week, we're going to put out a informational letter to those employees to allow them, anybody that wants to meet one-on-one with either Matt or myself or both of us, we will afford them that opportunity to go over any concerns they have. So I just want you to know, just like Mr. Greg, we were kind of shocked by this yesterday, and after looking into it, feel a lot of it is very unfounded. Thank you, ma'am.
Thank you very much, Mr. O'Brien. I'm gonna move on to the next item, which, and you're welcome to stay on, but you're also welcome to leave the meeting. I know you all have a lot to do. We're gonna go on to approving the minutes and follow the rest of our agenda that was published. So thank you for adding this to the agenda.
Thank you, ma'am.
Is there a motion to approve
Move
the
for approval.
April 23rd minutes? Sorry.
Second.
All in favor?
Aye.
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 All right, great. We're on for new business. I'm going to leave the microphone now and turn it over to Director Kay Cross, and I'm assuming maybe Heather Pope or whoever's going to lead this, and Ms. Wharton potentially. The first item is to review and approve the 2021 healthcare budget and the resulting contract awards that we're being asked to consider and then recommend to the budget committee and on to the full council. Take it away, Human Resources.
Thank you, Councilmember Jackson. I want to thank all of the committee members for being at the meeting today. I appreciate your time. We're going to start with the healthcare budget, and for that, I would like to turn it over to Jolene Dean so she can go through the numbers with you. Thank you.
Good afternoon, everybody. I'm Jolene Deems. I'm not sure if all the new council members have met me. I work with Amy Wharton in the Budget and Finance Department. And I'm going to go ahead and share my screen so you can see the healthcare budget, and we can go over it and ask any questions. So for some of the new HR committee council members, I thought I would kind of go over just a little bit of background on the medical cost and how we budget for the medical claims. The city of Charleston is self-insured, which means that we don't pay a straight premium to Blue Cross Blue Shield, but we actually pay them a TPA fee for them to administer and pay our claims and for their contracts that they have with all the medical providers. But we actually, the city pays for our actual medical claims. So if somebody goes into the hospital, we actually pay for that cost. So we're self-insured. We have a stop loss insurance plan, which is at a specific, our current is at $250 for a specific person. Over that amount, the insurance or stop loss kicks in and covers the rest of those claims. And then we also have an aggregate total as well. So for this current year, we budgeted $17.4 million. And currently we're under budget this year through July. You know, we're seeing kind of two extremes in our medical claims costs this year is, you know, people that are really sick are going to the hospital, or people who have COVID-19 are seeking medical care, but most other members are not typically going to the doctor. You know, most of the elective surgeries have been canceled since this early spring. And so, you know, some of our medical claims are, so we're lower than expected through July, but we expect once things kind of get back to normal, that we're going to actually be paying those claims in 2021. So in discussions with Aon, our broker, and with Blue Cross Blue Shield, you know, we are budgeting, or I'm recommending that we budget $19 million for our medical cost. You can see that number is right here for $19 million. Our dental claims, we're also going to be pushing some of our dental claims into 2021. So there'll be a small increase in dental claims. A lot of people are postponing getting their cleanings, and, you know, probably unless they have emergency dental needs, are really not going to the dentist as much this year. So we are slightly under budget in our dental cost as well. Prescriptions, people are pretty consistent with their prescriptions, and we anticipate still receiving about $1 million back in rebates. Our vision plan, we are fully insured for vision, so we pay premiums. So this is just calculated based on our rates that we pay for our vision premiums, and it's based on the number of people enrolled. You can see we're not proposing any plan design changes this year, so there's no change here. And our administrative costs are actually, I'll flip over to the administrative costs. You can see the administrative costs right here. We have rate blocks for most of our for our administrative costs. So really the change in the administrative costs is really because we have fewer people signed up for the plan. And right now with the hiring freeze, we don't anticipate we've actually reduced the number of people we're budgeting for. Last year, we budgeted for 1,620 members, and next year we're budgeting for a straight 1,600 members. The difference in the admin fees is the stop loss. Every year we have to go, we look at the stop loss numbers, and that's a contract that has to be bid out every year. In our renewal packet we got with Blue Cross Blue Shield, and you can see the first number that went out with the agenda packet, we had an estimate of a 30% increase. And we got back the renewal for the stop loss, and for a $250,000 increase, it was going to be significantly more. And but if we reduce our deductible from $250,000 to $300,000, we anticipate that this is basically what the renewal would be with Blue Cross Blue Shield. But as we do every year, we're having Aon market the stop loss. So as you can see on the agenda item, we're actually asking for the stop loss piece of the healthcare budget to be deferred until and taken straight to Ways and Means at a later date. Most outside stop loss companies will not give us a quote until we have our claims through September. So we anticipate bringing the stop loss contract to you in either the second meeting in October or the first meeting in November. But given that open enrollment starts in the beginning of October, we'd like to present the healthcare budget to you now so HR can start planning for the 2021 year. So going back to the budget, you can see this kind of wraps up most of the chunk of our healthcare costs. You can see it's a 7.8% increase in healthcare. Last year, if you look at it by the members, if you take the total cost by the number of members, we only budgeted a 1.1% increase last year. But this year, it looks like that our increase is going to be 9.1%. So it's a significant increase in our claims cost. for 2021. Most of the other costs is the same. I just want to point out though, for vaccines, we always pay for the flu shots for employees every year, and we've added, I don't know if you could see this because of all the way the gallery is, but I'll turn it over this way. But it looks like that the COVID-19 vaccine is going to be around $35 a person. And so we're anticipating, we usually about 500 employees come forward to get a flu shot. I'm assuming more employees will try to get the COVID-19 shot. I know there are some people who will still be hesitant on getting the shot, but we're anticipating that we'll spend about $35,000 on COVID-19 vaccines, and that we would like to offer those to employees at the city here. Most all of the other numbers are the same. The only other, I think, increase that we are proposing though is in employee premiums. And so I'll point out the premiums too. So in, let's see, sorry, let me get this across so you can see. So in 20, here are our 2020 premiums. Let me see, oh, sorry. And I think they're included in your packet. I'm not sure if you've had a chance to see, if you could see it better by category. We're proposing for basically the HSA plan. It's about a 4% increase for the different tiers of the HSA, and in the HRA it's a 7% increase. So you can see the annual increases over here. Let me see if I can hide some of these so we can get across. So you can see the categories across over here. There you go. So you can see the HSA premiums. If you are a smoker, your rate for 2021 would be $140.50 per pay period. So that's a total annual increase of $130 a year. An HSA family with a non-smoker discount would pay $99 a pay period, and they would have $104 increase for the entire year. The HRA is, that's our more expensive and richer plan. So the highest increase for employees would be $13 a pay period, and it would go to $204 with a $338 increase for the entire year. Given that we have such a huge increase in our claims, anticipated claims for 2021, we feel like that this is a fair increase for the employees. Does anybody have any questions?
Are there any questions? I don't really have a question. I think you've done an amazing job of putting it on paper for us, Jolene. I just wanted to point out that I am amazed that you were already thinking about the cost of COVID vaccines, and that's reflected in this budget. I mean, it's a small number overall when you're dealing with $23 million. So I think that's, for me, that's emblematic of the care and the carefulness that you all have provided to analyzing this before you put it in front of us. So thank you sincerely for that kind of deliberative work.
Thank you.
Anyone else? So would you like us to entertain a motion now for the budget itself, or is this going to be a
Yes, please. So I think, I think Jennifer, correct me if I'm wrong, but I think you have to say the updated budget that was sent up the second.
right? Did.
Yes.
So
Yes.
we would like a motion to approve or recommend to the budget committee, and then the budget committee will send it to the full council. So our job is to send it to the budget committee. Is that correct, Ms. Cross?
I think we have to ask Amy that question. Amy?
We'll discuss it, Councilmember Jackson, in the next ad hoc, but it will come to full council for approval.
I think
Ultimately. but it might be changed by then, right? So we're putting forward this budget in order to send it to the budget committee that then will put the whole budget forward to the council.
I think in years past, it's gone straight from HR committee to Ways and Means.
That's
does.
correct.
It does go
Okay,
straight.
so
to-
then that's the motion, the amended budget to go straight to the full council for Ways and Means.
So moved.
Approval.
Second.
Is there any other discussion or questions? All right. All in
Aye.
favor? Aye.
Aye.
Any nays? Great, thank you very much.
Thank
Really,
you. And then Councilmember Jackson, I think I need one more motion to defer the stop loss agreement to a later date. And if you guys are all in agreement, we would just take the stop loss contract directly to Ways and Means.
all right, I'll entertain a motion to that effect.
Second.
All in favor?
Aye.
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 Thank you.
Great. Thank you
Thanks
so
for your
much.
coaching.
Yeah, thank you.
Thanks.
All right, so are we now going to look at the contract renewals, or do we need to vote on that? Our vote just included sending those along to the Ways and Means, correct? Ms. Wharton?
Yes, that's correct.
Okay. So then we're on to item C, COVID-19 update.
Councilmember Jackson, I provided an update when we had our last meeting in April, so I thought that the HR committee, and you all may have received some of this data, but thought it would be helpful to go over. Knock on wood, we currently have 0 positive cases as of this week, actually midweek. Cumulative cases since March, 119 positive cases, and we still have 7 people waiting for results. The turnaround time on the results has definitely improved. We did get to a point a few weeks ago where we were waiting about 2 weeks to get results, but that has improved, and a total of 590 employees tested. So all of those employees that are tested, we are tracking them. Jan and the contact tracing team are in contact with them to figure out who they've been in contact with, tracking them to make sure we get results. And then we're also tracking them from a leave standpoint. So that definitely has hit a lot of our workforce, as it has our community as a whole. As far as an update on the First Families Coronavirus Response Act, we talked some in the April meeting about that. This is just to give you a picture of the usage of the leave in the last 10 pay periods. A lot of that is highly reflective of this number right here of the employees tested. So 567 employees have used.
Ms. Pep, if you're sharing a screen, I don't think we can see it.
Oh, I'm sorry. I apologize. Let's see.
I thought you were being brilliant by memorizing all of these things.
Let's see. Here we go. Can you see that? There we go.
There, yeah.
Okay.
It's coming.
Sorry about that.
No problem.
So we have, over the last 10 pay periods, since the beginning of April, 567 employees have used a total of over 20,000 hours of COVID leave. This leave to date has cost $369,000. For COVID-19 symptoms and being advised by a healthcare provider to quarantine, we've had 470 people use that for over 17,000 hours. This leave equates to over 329,000. 88% of these were people with COVID positive symptoms or close contact to a positive person. For caring for an individual or a child at home, we've had 53 employees use 1,615 hours, and this equates to about $19,000, close to $20,000 in leave costs, and 89% of these were people with childcare needs. And we've had 44 of those go on to use, continue on to use emergency family medical leave for 1,918 hours, equating to $20,475. On the unemployment front, that has been busy as well. In 2020, we've received 147 unemployment claims compared to all of 2019, where we received 37. We've appealed the majority of these. A few of them were things that would warrant unemployment. many of them not, and we've participated so far in 11 appeal hearings. I think 5 in the last week. In compared to 2019, and all of 2019, 3 appeal hearings. So for the first 2 quarters of 2020, we've been billed $86,427 in unemployment cost. The most of that was in quarter 2, as you would expect, which began April 1. They did reduce our balance, which was over 74,000 to 37,000. And this was a result of funding that was received from the state from the CARES Act. So for all of 2019, just to give you a comparison as to what would be sort of normal, we paid a total of 34,000. So that has been busy. We've cross-trained another staff member to help in responding to these claims so we can respond to them timely and try to avoid the appeal process. And as we talked about before, we're a reimbursable employer, so we're paying 100% of those claims. Any questions about those stats?
Could you remind us? I don't remember our looking at the 86,000. You said that's what we've been billed, but is that number now going down?
It's going down. So quarter 1, they did not make an adjustment, but that quarter 2 number, the 74,484, got reduced to 37. So that number would go down, that overall number.
Okay, and then are we being charged while we're in the appeal process? Are we actually paying out benefits while we're appealing their claim?
We are billed on a quarterly basis, so we are appealing things from quarter 2. And so I'm not sure about we're right to the point where we'd be paying that bill because we just received that adjustment. So
do you have any other questions?
The appeals have gone favorably so far.
Madam Chairman?
Yes, Councilmember Gregory.
The unemployment claims, do we expect for that to go down?
I'm hoping so.
We don't? Okay.
I hope so.
Oh, you
She
said
said
hope so.
she
Okay.
hopes so.
Okay.
I think a lot of employees were confused when they filed. Sometimes they were filed on behalf of a secondary employer, and the employee went ahead and agreed to receive the claim from both of us. So I think some of that's an education standpoint, but the Department of Employment and Workforce has been sort of stern on that it's on the applicant and how they apply, and that they need to be careful when they're clicking through and approving and agreeing to things.
Because for the record, we have not laid anyone off, correct?
That's correct.
Madam Chair.
Yes, Mayor. Welcome, Mayor.
Well, thank you. And you may have covered this and I missed it, and it's probably more a question for Amy rather than Heather. But are these 20,782 hours of COVID-related leave eligible for our CARES Act reimbursement?
They are, Mayor. They'll be included in that request.
Terrific. Thank you.
Thank you.
Thank you for a really thorough report, Heather. Does anyone else have any final questions or thoughts before we move on? All right, now we're on to item D under new business to hear about the employee survey update. And I saw Ms. Novak's face when we first all signed on. So welcome, Julia. We're really happy to see you again and invite you to educate us about what you all have been up to.
Thank you very much, Councilmember Jackson. We're very pleased to be able to share the results. I got to make sure I'm sharing the right screen with you all. Josh, did I got it right?
Looks good to me.
All right. So we're pleased to be able to share these results with you all. And you might recall that we met with some of you at the beginning of the process before we did the survey. I think it was in late 2019, before we administered the employee survey. So there's 2 pieces of our report today. One is kind of the workplace profile. We did this a couple of years ago. We added some additional slices of the data based on y'all's request this year, but we're going to share kind of the 2020 results and how it differs from 2018. And then we're going to go into the employee survey itself. My colleague Josh Rounds, Josh is a senior consultant with us, and he is going to be going over the workforce profile information. So Josh, I'm going to be clicking the screens for him. So hopefully I do a good job.
Well, no worries. We will play it by ear and tag team it. But before I kind of dive into the slides, I did want to make sure we acknowledge all of the city staff who have been a tremendous help to us through this process. Specifically, folks like Amy, Jolene, Kay, Ryan Landry, the finance and HR groups, and anybody I may have left out. We make a lot of very detailed data requests when we go about this work. It can sometimes be a pain in people's sides, but we appreciate everybody's patience because that information really helps us to provide this high level view in this context. So maybe to dive in kind of at a high level, when we look at the workforce snapshot as a whole, our methodology here was very, very similar to what we did in the last study report. So the intention here is to provide kind of a snapshot of the workforce as it appears or appeared earlier this year at the time we were looking at this data. And so, when we kind of break down the demographics, on average, this is among all city employees across all departments. The majority of the employees are male. About 2/3 identify as white, with the remainder identifying as either Black, African American, or another minority group. The average age among employees is about 42 years old. The average tenure with the city is about 8 years. The average total compensation on an hourly basis for employees is just north of $32, about $32.60. And that again includes some assumptions about both earnings and benefits. And then with respect to the amount of time folks have left before they're retirement eligible, again, on an overall basis, it's about 19 years or so. But we also then kind of split up our view to look at public safety departments. So that would be police and fire departments. And then the slide after this, we will talk about a view for all of the other remaining departments as well. So
can I raise a question?
Sure.
I see that you've lumped all people of color under Black, African American. Do you do any breakdown with regard to Hispanic?
Yeah, and I'm sorry, it might be a little bit hard to see on the slide, and in the report we have an additional breakout as well. We do have a subgroup. We use the same racial ethnic groups that the U.S. Census Bureau uses, so we break them out at a high level the same way the census does. For the purposes of the slides here, we've got sort of the Caucasian, Black, African American group, and then the remaining groups summed up in that percentage. It's on the top right of the slide there. That 4% would be any other racial or ethnic group that the census uses.
Okay, thank you.
Mm-hmm. So with respect to the public safety departments, police and fire, here again, the patterns are very similar to the overall average. Most public safety employees tend to identify as male and white, very similar there as well. They are a little bit younger, about average age is about 37 years old, but the average time with the city at 9 years and average years until retirement eligibility at 18 years is again very similar to the organization-wide average. And the total compensation rates here as well are highly comparable at about just over $36 an hour. And then with respect to the non-public safety workforce, so that would be all of the departments aside from police and fire. These departments tend to be a little bit more diverse based on the demographic data. So a much more even split here in these departments between male and female employees, as well as among the various racial and ethnic groups that folks could select from. And then the other notable difference here when comparing back to public safety is that folks in the non-public safety departments tend to be a little bit older on average. So average age of about 45 years. But again, tenure with the city and time to retirement, highly comparable at 8 and 20 years respectively. The other notable difference with this, with the non-public safety departments is that the average total hourly compensation tends to be a little bit lower than public safety at around $29 for earnings and benefits there as well.
If I might just add, so, you kind of think about the city workforce as a whole. When we're looking at non-public safety, it's pretty even, male, female, people of color, white. When we give you the city average, it still looks very tilted towards male and white. And that is largely because of the public safety departments. And, in particular, the city's fire department, which I know has been working on this, but it is, tends to be very male, very white. And so those larger departments, public safety departments, kind of skew the average overall. And so it's important to see the non-public safety workforce as well. All right.
Absolutely. And then we have the next slide here. Yep, compares back to 2018. There is quite a bit of consistency, I would say, between 2018 and 2020, with some notable movement in some key areas. So again, highly similar in terms of average age, years working for the city, retirement eligibility, things of that nature. One of the key trends that emerged is that the average hourly earnings did go up the last couple of years. So that's a sort of a recognition of the city's progress there. We also saw an increase in average hourly benefits. Part of that is because with this iteration of the workforce profile, staff were able to give us some much more detailed information about benefits that we were not able to capture in the last effort there. So we're hopefully a little bit more precise in this study effort, or this version of the study, with respect to some of the total compensation estimates there. And then with respect to the racial, ethnic, demographic breakdowns, again, very similar. We're talking, a percentage point, maybe two, in sort of either direction, depending on the group overall. And they split then on a gender basis, male, female, again, very similar to 2018. A couple of the things that we were asked to look at in more detail for this workforce profile included employee turnover rates. So we got some really detailed information from staff that let us kind of dive into that and break out the turnover rates on a citywide basis, as well as a public safety, non-public safety basis. That's kind of the line graph you're seeing here. So the top gray line is the non-public safety group. The light blue line is the citywide average. And then the dark blue line is the public safety average. The notable, I think, takeaway here is just that the public safety group actually has a fairly low turnover rate compared to some of the non-public safety groups. And when you average that out in 2019, average turnover rate was about 18% or so. And then the other key question we were asked to dive into in some detail involved earnings by demographic group. So what we did is we took a look at the specific pay grades that the city classifies employees into, and then did an analysis on the demographic breakouts within each of those pay grades and among the pay grades as a whole. The key findings there are really just that within each of the different pay groups, employees are generally earning about the same, regardless of their race, ethnicity, or gender. If you kind of zoom out and look at the pay trends on a macro level basis, there are some differences in race, ethnicity, and gender between, especially on the non-public safety side. What we tend to find is, toward Julia's earlier point, because there's a difference in the demographics for public safety and non-public safety departments. That is to say, the public safety departments have proportionally more white and male employees. That accounts for some of the discrepancies we see in the earnings data. And I've got a couple graphs here after this.
Yeah, more white, more male. And again, remember too, more highly compensated than the average non-public safety employee. So that skews the data. Key finding at the top there, that in similar jobs, regardless of race, ethnicity, or gender, people are paid equitably. Whoa, sorry about that.
Correct, yeah. And we've got some graphs that kind of help to illustrate that point. Yeah, here we go. So for example, this is a breakout of all the different classifications along the bottom. And what we're looking at here is the split between employees who identify as white within each pay grade and employees who identify as non-white within each pay grade. And again, you can kind of see that based on where employees are in various departments and within various pay grades, that's what's sort of impacting the skew there as far as the overall finding. And there's a very similar graph here with respect to gender as well. So we see a more even split between male and female towards some of the mid-range pay grades, toward the top. Some pay grades actually, I think on the top pay grades tend to have more males in them, which tends to skew the average rate then up a little bit because of the proportion of male female in those pay grades as well.
So hopefully those that additional information is something you found responsive in the overall report. And I know it was something that you were interested in, so we wanted to provide it for you. So I'm going to go ahead and jump in to the overall survey, employee survey results. So we administered the survey this year between February and March. And the questions generally ask people to either agree or disagree with a statement. And they're all framed in a way that we can assess the overall level of agreement as in a positive way. There's also a few open-ended questions. We allowed for paper surveys this time as well, so people could fill it out on paper and they were mailed to us. And so that folks who didn't have access to technology in their workplace might be able to also participate this year in greater numbers. So we did have quite a few folks that took advantage of that. We have great results kind of overall this year. We had better response rate with the over 1,200, almost 1,300 employees respond to the survey. And the general level of agreement increased by 6%. So kind of overall, people agreed with 78% of the statements in the employee survey, with that highest category, the same as 2018 as in 2020, being questions that center around employee engagement. There's a couple of things, and we'll get into some of the category changes. But one of the things just to, kind of look at and note, I think with some real pride for the city in terms of how they did on things. There's a couple of key questions that improved pretty significantly. In 2018, one of the lower category ratings was in department leadership, and they had tremendous improvement in that area this year. So wages and benefit were also a very low category in 2018, but it was better this year. And I would say in general, communications and employee wages are the bottom two agreement levels in any organization when we do this type of surveying. But the progress that you made is important, and I want to talk about it in particular with a couple of departments. So first of all, here are all the categories that the questions are in. And again, there's a lot more detail in the report. But what you see, and again, I think should be really pleased with, is across the board, positive increases in every single category. Tremendous strides with regards to professional development, department leadership, and the overall direction of the city. And I think one of the things that you see is that as employees have increasing confidence in their department leadership and the general direction that the city is going, that creates an environment where people are more satisfied and engaged overall. So these are all the categories. You see the agreement. This next slide breaks it by department. And, one of the things, we had some departments that also made incredible strides, kind of worst to first, if you will, in terms of overall scores. And so we're really pleased with the effort that the city made to change the results. The whole idea behind doing an employee survey is to figure out how you can move the needle and improve employee engagement. So a couple of areas with minor decline, but for the most part, the departments went up overall, with some increasing quite significantly. I think new leadership in the fire department dramatically increased their results, and IT took a real serious approach this year to addressing some of the issues in the survey, as well as planning. And you see those things, you see the results in this survey. In the open-ended responses, we ask some open-ended questions and we code those. They tend to fall into categories about increased wages, enhanced communication, greater use of technology, and potentially around improving coordination and communication between departments, which is something that we saw as a lower score in some of the different departments that tend to rely on each other for collaboration. I want to make a comment about I'm trying to go back to the question around wage and benefits. I was curious, your earlier agenda item today, receiving that information. When I met with Tom O'Brien this week to go over his department's results, it's just interesting to me to note that within public services, which is where environmental services is housed, the questions about being satisfied with the city pay and benefits, you see on average, the level of agreement was 64%. But within public services, it was 91%, so a full 19% better than the rest of the organization. So I just thought that was an interesting kind of contrast with some of the things. And of course, this is pre-pandemic, so I realized some of those issues might be pandemic related, but I thought I would mention that today as a note of interest for you all, given other things that are happening in the city. Again, overall themes, what I would say, employees are generally, they're dedicated and engaged. They have positive relationships with their coworkers and supervisors. Compensation is always the womp womp, it'd be nice to get paid more. And communication always could be improved. And then, employees on the whole believe that the city values diversity. And what we like to point out is that those of us who are white tend to have a more favorable view of that question. So white and than non-white employees. So I just, like us to keep that in mind when we see this data. Just a note too about our methodology.
Hey, Julia?
Yes, sir.
Can we go back to that screen for a second?
Absolutely.
And I think it's the third bullet. Many feel there's an opportunity to revise compensation for more, blah, 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 blah.
Yes.
Did you break that down by salary, by color, ethnicity? Did you do any breakdown there? To see whether or not there's any specific group that might have more concerns than the other?
That's a fair question, council member. And my recollection, I know I've gone over all of this with the departments at a department level. I don't think I have a demographic breakdown there, but that's certainly something that we could, I think we could do, right, Josh? And just in terms of a different way of slicing that data. So
yeah, that's correct. And I think that the finding there really comes out of both people's responses to the survey rating questions that we ask, as well as the open-ended results. And so there is some fuzziness with how we're able to break that out demographically, but it's something that we can explore.
Yeah, what's interesting, and so just as a contrast council member too, I mentioned before public services, 91% were generally pleased with the benefits and pay offered by the city. So that's incredibly high level of agreement on the compensation question, given 64% overall. And
that is where a large number of the minority employees are.
Yeah, exactly. And then in other, in your public safety departments, which tend to be paid better, their score there was much lower. And so it's not about the dollar value, right? It's about, people's perception of contribution and worth. And I also think that there was a real movement within some of the general, governmental services because of the effort that the city made to increase some of those low salaries. And people recognized that. And I think that was also reflected in the tone of some of the comments, like there was some gratitude and appreciation in those areas. So I think it's important to note that.
Did you also take a look at why our public safety department is majority white males?
Well, we didn't get into the why. I think historically, there's a lot of reasons why those things exist, but this was really just about what the demographics are of the different organization. And I know that I've met with the fire chief. I haven't met with Chief Reynolds yet, but I know that that's a concern in an area that he's focused on.
Thank you.
So just to kind of remind you all in terms of methodology, what we use for our survey methodology, we call the key driver analysis. Basically, it tells us, you know, what makes a happy employee? What's the secret sauce to getting those overall agreement with the employee engagement questions? So they were slightly different between 2018 and 2020. So just kind of want to make some note of that. There was a little bit of change, and also, you know, again, the scores varied by the different areas. But it was less important this year, the overall direction of the city, which was much more positive, and department leadership kind of raised to the top in 2020.
Do we have any? Oh, sorry. Do we have any idea why the relationship with residents went down?
So it didn't go. I would say is it went down because it didn't go up. So what I mean by that is that in 2018, there was less perception that the relationship with residents was positive. And I think it was more positive in 2020. And so it did not necessarily have that impact on the engagement piece. So again, these are the things that if you work on them, you're going to improve the overall level of engagement. So I want to share with you a couple of the key driver statements that, you know, that are related to engagement that we focused on. So 2020 is feeling respected in the workplace by department leadership. The ability to make a change if something doesn't seem to be working, and getting the connection between my individual work and the overall goals of the department. So slight change from 2018. What we appreciated, you know, we appreciate our relationship with the city of Charleston because we're there with you as you really work on moving the needle in some of these areas. And one of the things that the mayor and his team took very seriously was the results of the 2018 survey, made some changes. And I would say going forward, continuing to work on those relationships between employees and direct supervisors. That's an area of general satisfaction, and it is critically important to employee engagement. The value on diversity and inclusion is very important, and I think becomes increasingly important as our country is in this big crescendo right now, just dealing with some of these events and issues in a more straightforward way than perhaps we have before. Helping people make the connection between their individual job and the goals of the broader department, and making sure folks have the information they need to do their jobs. I think the focus on innovation and creating that culture of innovation is going to provide an environment where people are more comfortable taking risks. And so continuing to do that in a measured way and getting more feedback from employees as they do their job, and take the barriers away so they can contribute in a positive way. So again, this should be nothing but good news, I think, for the city this year. And we can all use a little bit of good news right now. So we appreciated the opportunity to work on this. And like I said, we've been meeting with all the department directors. And for you all to understand that the city takes this information, there's an overall work plan, and then the department heads have a work plan. Mayor, yes.
Go ahead, Mayor.
I just need to sign off for another meeting. I'm sorry I got to leave, but I wanted to thank Julia and John for their work with us, because what we're trying to do is, I think, evident, is create a culture where we're always trying to improve ourselves and improve our relationships and engagement and communication. So, you know, even though this is good, I feel like it's a good report. It's just a bellwether that we need to keep up these efforts for improving our organization.
Very good.
Sorry, got to leave.
Thanks for being with us, Mayor. So, Ms. Novak, are you finished with your consultation on this particular thing? I know you said you hadn't met with Chief Reynolds yet.
I have a couple of department heads. Just a couple of department heads I still need to meet with, yeah.
And then maybe Kay will let us know what is the next steps for the report. Do you have little focus groups among the departments, or how do we, you know, put this into action, the thing that Julia's telling us to continue to work on, or what's your game plan for all of that once the budget's done? I know.
Well, I think I'd like to, have a little more time to thoroughly delve into the report. You know, as Julia said, one of the things employees continue to voice some dissatisfaction over is their pay, and I'm not very hopeful that we're going to be able to do a lot with that for next year, just given, the situation that we're in, because of the pandemic. I was actually looking over my goals and objectives that the mayor and I had discussed last year, and they're very different than what they're going to be. I think communication is something that we need to strive to continue to improve. It's not something that generally has a cost to it. I think that's something that we should try to move forward. And I think that, that there's a couple of things, that was in the survey. Employees really like flexible work schedules, working from home. And I know Councilmember Jackson, that's on the agenda for later. But I think that's one thing we can also do is continue working on our telecommuting policy and try to streamline that. I think that overall employees like having that option. So I think there are some things we can do to hopefully continue to, to promote, happiness amongst our employees. But again, I think we are going to be somewhat limited with budget and with funding for next year, more so than I thought we were going to be this time last year. But anyway, I'm also open to, any recommendations Julia has as well. She did, Councilmember Jackson, provide some, what I thought was very interesting information about telecommuting and, kind of what, best practices. And that the little video you sent me, Julia, was really cute. I like that. Yeah, I think that I think that once we've had a chance to really absorb it, have some further discussion, with the department heads, I think that we could certainly provide to council maybe more of a formal plan for how we plan to move forward next year.
Could I add on just a little bit, Kay, just to kind of going back for the, how have we worked this? One of the things that we've done is we have a process for sharing the reports with the council. Once they're shared with the committee, as they've been with you, they're available to the full city council. The departments all have their results, and we work closely, our partnership through the mayor's office with Amy and Susan Poteet in the Office of Service and Process and Service Improvement kind of drives some of the organizational work planning. And so those groups own it for the organization. So Kay doesn't have to own all of it. She plays a critical role, and my hat really has been tipped to her because the improved scores in communication are directly related to them reinstituting the employee newsletter 2 years ago, and they really made some efforts. But it's a shared responsibility for the whole organization, and that'll come back from the mayor's office in terms of a work plan.
Okay, that's great. And Councilmember Shealy, I'm sorry, I just saw your hand before Ms. Cross started talking, so go ahead.
Thank you, Mr. Chairman. I appreciate it. Julia, just wanted to ask you, do we know what percentage of the respondents took the survey in 2018, or how many may be first time?
So we wouldn't know if they took it before or not. All we know is the difference in the response rate from 18 to 2020. So we did have a improved response rate. So you would assume there would be some new people, plus, general attrition, obviously the turnover, that's going to change things. But 74% response rate of all employees is incredibly high. And we thought we did great in 2018 when we had 68% response rate. So we look for anything north of 50 is fantastic. And if you have between 30 and 40, you've got valid results. So this is really terrific.
Thank you.
Yeah, I remember that from the last one that you said it was exceeds expectations by margin. So I'm glad we're going in the right direction. And word of mouth must have been positive, or people would have voted with their feet. I'm assuming that.
Right. I think the confidentiality piece is something we try really hard to get people comfortable with. It comes back to us. We can't trace it back to any individual. And so It increases people's comfort level when we're administering it, and we feel really good about that connection with the city. Even the paper results this time, knowing that they were coming straight to us and we coded them. So,
Madam Chairman, you're on mute.
Oh, I'm sorry. Go ahead, Councilmember Gregory.
I just have a couple of questions. The non-public, comparing the non-public safety and the public safety, it clearly showed that there was a difference in terms of our hourly wages, if I'm not mistaken, about $3 or something like that, if I recall. Do we know why there's that difference? And the reason why I'm asking it is $3 an hour times 40 is 120 a week. And if I keep going up, it's a considerable amount of a difference. And then as a backup to that question, do we have a comparison of the hourly rates between non-whites and whites, regardless of the department, be it public safety or non-public safety?
Yeah. So what I would say on the public safety to non-public safety, and Kay may want to jump in on this also, but you know what we see in all organizations is that your public safety employees are paid at rates that are competitive with other public safety departments. Most municipalities, if they're benchmarking their pay, they're benchmarking it in job classifications that translate to, you know, comparable jobs. And so if you're paying market to a laborer, it is a different pay market than it is to a police officer or a firefighter. So that is, you know, a piece of why public safety makes more. They tend to make more than most job classifications in all organizations, in all city governments. That would be a common.
Within the public safety department, okay, what is the difference between the hourly rate for non-whites and whites, and the same thing with respect to non-public safety?
Yeah.
What's the distinction between the hourly rates among the various groups that make up the organization?
Yeah, so what I would lean back on there is the data that we looked at was within every job classification. And so if you know, job classification, whatever it is, we looked at pay across the racial and gender. And what we found was that an employee in a job classification made same amount of money regardless of race or gender. And that was a critical finding, just to have that data point. So it depends.
I think so.
Pardon me?
I think so.
Yeah. So that was very important, and that's in one of the slides. And I'll email this slide deck to Kay or whoever I should to get it to you all, so that you have them as well.
Yeah, we'd love to have that. Thank you so much.
Thank you.
I hate to cut this short because I'm always interested in, you know, all the things to do with keeping track of our employees and how we can better their engagement in their job. Engagement seems to be one of the new theme words that we say a lot these days. But we do have 3 other decisions to make, or at least considerations. So I'd like to move on to new business item E. It's titled A Report from the Women's Commission. And basically we have 3 recommendations in front of us to consider as the Human Resources Committee. And we will be considering them, taking a vote, assuming that there's a motion to do so, to forward them to the appropriate place for consideration or enactment. So to introduce the 3 items that the Commission on Women have put in front of the Human Resources Committee, I invited Janet Robinson Alterman, who some of you remember a couple of years ago, Janet and I came to the Human Resources Committee for the first viewing of your employee survey, Julie, because we were very interested and obviously the demographics and the outcomes to all of that. So I can't say enough about Ms. Alterman's leadership of the Commission on Women, her leadership around the state and the Atlantic Seaboard for women in general. She's former chairman of the Women's Rights and Empowerment Network, former executive director of the Women's Center here in Charleston. And now she's happily retired sort of to Wadmalaw, but she comes to the city to do her thing for the women. So please introduce the topics, Ms. Alterman, and I know you need to get off the call as you do so. So thank you very much for being here.
Well, I appreciate that very much, Councilmember Jackson. And I also want to throw kudos at the HR department for the city. Y'all have done an amazing job. And we really appreciated it several years ago when we came and talked to you all about short-term disability. And you jumped on it and you got it done. So today I'm here to represent the commission with unanimous votes on everything to present 3 items to you, 2 of which have no financial impact. The third has a huge financial impact. So, and I understand the shortages we're looking at with the budget, and I respect that. The first is we would like to request that the city take the salary history question off of the job application. And Kay, I know how you use that, and I'm a former HR person myself. But particularly in recent years, it's been shown that it can create sort of an implicit bias sometimes if people are making far less than maybe what their new job is going to pay. And that affects women and minorities more than anybody else. And we just figured it would help level the playing field. And after listening to Julia's report, I think it can't do anything but help. And I hope, Kay, you can agree with that kind of thinking. The second thing is we have looked as a commission at the impact of the pandemic on the working from home situation, and particularly women working from home. And I understand the city has men and women working from home, and your temporary policy, Kay, is excellent, absolutely excellent and very thorough. We would like to make one recommendation, and that is to include within your within your policy that employees have to log on and log off so that they don't leave their computers open on the dining room table if somebody comes in with no malicious intent and goes and plays video games. That's a suggestion. I don't know what impact that would have in terms of the technology, but it is a suggestion. The third piece, and I did read your minutes from your last meeting, and I know that you discussed this in great depth. And of course, we brought to the council 8 months ago the possibility of having a paid leave policy for the city. And I understood at the time it was very well received, and we hope that we might be able to move forward. Thank you, Ryan Landry, for being the ultimate patient tutor for me in all things around paid leave. But we did come up with a staggered approach that we originally wanted you to consider starting in January of 2021. We realized that could be difficult, but because the whole plan is laid out in 6-month increments, you could bump it until you get to where you can start that funding. And I don't think anyone is going to find fault with that, but we want to keep it on the table, definitely.
So we're still
And you have that.
We're still talking 12
Sorry?
weeks, right? We're still talking 12 weeks.
Well, no, we started it differently. We did a staggered plan. It should be in your packet with 4 weeks.
Okay.
And then we went up to 6 weeks. And then we did it incrementally that way. So it's not one giant hit in any particular budget year. And I think for the third year, in which the last 6 months would be 12 weeks for the categories, it was still under $1 million. Am I right, Ryan? Does that ring true? 888,000, I think it was.
Yeah, for the proposed implementation, the total I have showed 898,000.
Yeah. And that would be, like I say, in the third year.
So,
anybody else have any questions? I mean,
well, I was going to ask, can you stay for our discussion of each of these items so that we can take
certainly, absolutely,
decision?
absolutely.
Okay, great. And then we can ask you.
You're muted.
You're muted, Carol.
Okay, sorry.
Councilmember Jackson, would you mind if I spoke to the first one?
You're muted, Carol.
Still muted.
Okay, sorry. I can't let my fingers do the walking and talk at the same time. So who said, may they speak?
That was
Please, go ahead.
Just wanted to share a little bit of information with you all about how we use that information, just so you have a context from a city HR perspective.
And we're speaking to the recommendation that we remove salary history from
The salary history question, yes.
from the interview process.
Yes, I was going to share my screen and just show you. See if I can you all see that?
Yeah.
Okay, how about that?
Yes.
Okay, so if you were to apply for a city job, our postings are done through Civic Plus, which is also our website. And this would show you kind of how you would view the required field. So over here, name, address, zip code. When you go on that box, it's going to turn red. It's going to have a red asterisk next to it, and it's not going to let you submit the application unless you complete those fields. Over on the right, once you move over here into describing, and it asks for in the last 7 years, the jobs that you held. Really all of these fields are optional, and it will let you pass through. Some people will submit an application and they also attach a resume, and sometimes they don't even complete these fields. So it's definitely not a required field. There is a starting rate and a final rate, but just to let you know, when somebody does include that information, how that falls into our process. So the beginning of the process is a job requisition, and that goes to budget for approval. Right now, they're not approving very many because we're in a hiring freeze, but this was one that was approved, I think, in January maybe. Budget would assign a salary range that you can see over here on the left side. Authorized hiring range, that's going to start at the minimum for the grade, and then it's going to go to a range. That range generally is not more than 7% high. And that would be somebody who may have a degree above the requirement that may be considered for this 7% above. So once a candidate is selected, the department head will submit a hiring salary request if that for a salary. If it's over the budgeted range there, we're going to, and even if it's not, if it's within this range, we're going to review that for education, their experience, certifications, and we're going to compare that to other city employees in the same pay grades and similar positions throughout the city. And then at no point is the current salary reviewed and determining a salary offer. So I know that in the private sector and maybe in some other governments, they may use that salary as a basis or a starting point and saying if somebody makes $50,000, we're going to need to pay them more. That's really not the case here. And oftentimes we may be paying them less than where they're coming from because we want to make sure we're maintaining equity within the city. So two things that we use this field and the information we receive as far as helping us. Sometimes we may receive an application and it may be somebody who is working in a similar position in another government entity. It may be one of our fellow local governments. And it helps give us an idea if the salary is a good bit higher than our other employees. It gives us a starting point to have a conversation with budget and looking at that, that maybe we're not competitive with the market. And sometimes we're also taking that in consideration with how long the position has been vacant, the difficulty we've had filling that position, but we would not just simply hire the person based on their current salary. We would take a look at other employees as well. And if we made adjustments, we would make adjustments to that group. And then also I've used this honestly in the last 6 months. Someone may put on their application that they're currently making $80,000 someplace else. And maybe I posted a range of 53 to 57. That gives me the opportunity as a hiring manager to start the conversation about salary, to let them know that currently the job we have posted has this range. I think a lot of times in other organizations, maybe that hiring range doesn't mean as much, and it looks like just a starting point for a negotiation. With the cities, financial situation, and the way that we use this and budget uses this is that is what's budgeted. So anything going outside of that's going to require a good bit of review by budget. So we normally would have a conversation with that applicant and let them know this is the hiring range. This is what we have budgeted. I've noticed that you're currently making $30,000 more than that. Do you still want to be considered and move forward in the process? And then sometimes people will say, yes, I want to. I'm looking for a change in career, whatever. But sometimes they will opt out, which allows us to move forward in the process and not waste their time or our time. And then in one case, recently, we had an employee who didn't list their current salary. When we got to the point of making that offer, they were seeking a position that made $30,000 more, and then that delayed our process and delayed us in moving on to the second candidate, which sometimes might make you lose a candidate if you've got a little bit of lag time there. So that's just to let you know how we use the information and the benefits from what we see. I can see how other organizations may use that if they used the current salary as a starting point and then looked at offering a salary above, but that's really not taken into consideration once we make that selection.
Thank you. That was very thorough and helpful explanation, Heather. I'm glad to know the context in which we would be asking for a different approach. So,
And Councilmember Jackson, I would just like
yes,
to add that the mayor absolutely values the HR committee and council's recommendations, and I'm sure he would really want to know how you feel about this question. But I would just like to share with you, this is more of an administrative type issue. It doesn't really require an ordinance or anything quite that formal. The first year the mayor was in office, he called me and asked me, there was a movement to remove that question on the application about criminal history. And he called me and asked me how I felt about it. And I said, I'm absolutely fine with removing it. It's, because whoever we select, we're going to do a background check on it. All that really does is prevent hiring managers from screening people out automatically without at least giving them the opportunity to maybe get an interview and maybe talk to them and maybe explain what happened. Maybe there's a reason for what that is, whatever it was. So I removed it the same day. So it's, so if, again, so if you all recommend to the mayor that you want the question removed, and if he is in agreement, we don't feel really strongly about it. We do use the information. We absolutely do not use it in a negative way. We do think there's some benefit to us, but again, this is not an issue that we feel very strongly on about, especially if all of you think there's more benefit in not having it than having it.
well, thank you very much, Ms. Cross. Councilmember Del Chapo, go ahead.
I guess, I don't see a downside to keeping the question. It's not required that someone answer it. I think it would be different if it was required fields. And I think the point that Heather made is very valuable. Someone may make $80,000 somewhere else and the job here may be 50, but if I'm making $80,000 in Manhattan, that's a whole lot different than $80,000 in Charleston. And so you don't know people's different situations and things like that. And this honestly gives you like a conversation starter that it wouldn't otherwise afford you. So there's no downside to it. There are potential upsides to it in my mind.
Thank you. Councilmember Brady?
Yeah, just because there is kind of a pejorative connotation around asking for the actual salary history, is there a way to kind of compromise and say, like, I've applied for jobs before that they just ask for expected salary in order to accomplish the same thing, so that if you're putting 30,000 or 40,000 more than what the kind of hiring range is, you can kind of screen that person out, knowing that it's not going to be worth your time.
Have you seen that in other You said yes.
Yeah, I've seen it in jobs that I've applied for.
I have as well, that, you know, what's your expected salary range.
Mhm. I mean, that is a same way of getting to the same early. I think that, you know, what impressed me about Heather's explanation to us is that you don't want to keep people, you know, on the line fishing for something that won't work out for both parties' reasons. So as an early indicator, I can see the wisdom, but I do feel like I know that Ms. Alterman could speak to the reasons that the Commission on Women came to this as a unanimous recommendation to us is, you know, we play in a much bigger universe these days, and to have that stigma is probably too hard a word, but to have that reputation that we are trying to, you know, protect our own interests as an employer compared to widening the net for people that might not normally come into the city to apply for a position. I personally am the kind of person that errs on the side of, you know, widening and trying to help people feel welcome and included in a job interview process. So, Councilmember Shealy, did you have something you wanted to?
Well, yeah, just wanted to ask, I guess, would the salary not normally be clear without that coming up?
That was a question I had too. Yeah.
Hi, this is Kay. Yes, we always post a range, and it's usually a fairly narrow range. I mean, sometimes it can be a little broader depending on the position. And I know that you would think that, you know, someone would look at that salary range and think, oh, well, you know, I definitely want more than that, so I'm not going to apply. But that's not always been our experience. I've been very surprised sometimes when we get to that final negotiation for someone. In fact, it happened to us just recently, frankly, with the internal auditor position that we've been trying to fill. We posted a clear range, but then once it came down to actually making the offer, the applicant wanted a good bit more money than we had posted, which I know that I don't really understand that unless they just think that's just, I don't know, maybe they think that we'll look at them and see how wonderful they are and we'll just pay them what they want. But it does happen quite often where people don't understand, and maybe it's a difference of people coming from private sector maybe to a municipality, that we just have we have more firm set pay bands that we use. So
I would say if we're talking about this as a communication tool device, I really am sort of warm to the idea of the expected salary. I mean, that takes the you know, the stigma out of it in terms of what we're trying to get at, but also would serve sort of the same purpose, or maybe identically the same purpose. So what do you think about that? Should we make that recommendation to the mayor?
I just think that we should leave it alone since it's an administrative decision. Just, I mean, Kay knows the sentiments. Just it's up to the mayor.
To the mayor.
Yes. Yes.
Not even taking any sort of.
I mean, Kay can tell him that, you know, there's been this discussion. I mean, just like the ban the box issue.
Mm-hmm.
I think we should let him do his job.
I mean, and I do have a meeting coming up in a few weeks with him. I'll be happy to, you know, to ask him and actually share that recommendation with him. And I'm very open to that. I'm very open to just asking that question. And I'm happy to talk to him and see how he feels. As I said, it's not a difficult, you know, change to make. And it's not something that, you know, like I said, I don't feel that strongly about it. I think that there is a purpose for it, but you know, if we didn't have it, we would still move on and hire people. So, but yeah, I would, if that's how the committee would prefer to handle it, I'd be happy to take that directly to the mayor.
All right, let's ask for a show of hands or nod of heads that's a good approach to take.
I agree with Dudley. You know, I trust that HR wants to make their jobs and the hiring process as efficient as possible. So whatever tools they need to help them with that process, and discuss that with the mayor. I agree with Dudley.
Is that the will of the committee?
I agree.
Agreed.
Let's move on to the next item that the Women's Commission has brought before us. The recommendation that we make permanent the opportunity to work telecommute according to the city's current policy. The addition to that policy is recommended that we add that security feature, which I would think the IT department would be very happy about. So how would this one be handled, Ms. Cross, if it leaves the Human Resources Committee just to make that recommendation? We haven't taken a vote or anything yet, but just procedurally, what would do next?
I think that the recommendation of having employees turn their, log off their computer when they walk away from it, I think is a good one. I think that's a good addition to the policy. And I think we have a good basic temporary policy. But having said that, I'd like to have a little more discussion with department heads, because I've gotten a little bit of mixed reviews on how the telecommuting has gone. I think there's ways we could improve, and enhance our processes and procedures around it, because as you know, we didn't have a telecommuting policy when this happened. And so we had to scramble and put something together. And to be honest, I haven't had an opportunity to really get with all department heads. I've heard, anecdotally, oh, this is working great, or this is not working so great. So I just think there's an opportunity there for us to make some improvements. But I think that's a great suggestion about the security, and I'd be happy to talk to the IT director and see if there's anything he can recommend. But the mayor has shared with me that what he would like to see is for us to make this telecommuting policy, some version of it, permanent by the first of the year.
I think that is the bigger recommendation, Ms. Cross. I didn't mean to confuse the topic. That the Women's Commission has made the recommendation to us and to you and to the mayor that we would make permanent what is currently the temporary work at home policy. So that's a big recommendation. How you structure it for, fine tuning it after you've talked to the department heads and things like that would be of interest to us, but I think the big recommendation was to make it permanent.
Yes.
I was going to get.
Yes, Councilmember Gregory.
Sorry.
Okay, Madam Chair. I
Yes.
think we did request when we started doing the telecommuting that someone will do an analysis of how it may or may not affect productivity, so that we can be making our decision be informed in terms of making our decision. Telecommuting is just as old can be. I'm surprised that the city has not really gotten into the modern era. It's cost effective because it saves money on both sides. Just from the commuting itself, in terms of the savings in gas and taking clothes to the cleaners. If you really add it up, telecommuting really is like a little raise because you will have more disposable income, actually.
And time. Time is money.
Yeah.
Quality of life. So, well, all right. I'm happy to say that this was a conversation that we're in agreement with, making it permanent, allowing or giving Ms. Cross the opportunity to consult with the department heads for how to make it better or more, a better fit to the overall city way of wanting this policy to become permanent. But I do think that maybe it would be helpful, since the mayor couldn't be with us during this conversation, if we at least took a vote to say we're in support of crafting a policy that will become permanent on January 1st, and then allowing the department heads and the HR department to put it together. How does that sound?
So moved, Madam Chair.
Second.
Second.
All right, great. Any other discussion?
I do
Go
just
ahead.
have kind of I guess kind of how chronologically this goes. So if, when you go and speak with the department heads, Kay, I assume then that a telecommute work from home policy is not going to be blanket for for all employees, but I wouldn't it have to kind of flex based on what your position within the city is? I mean, obviously there's some positions where they would not be able to telecommute. So we'll gain some clarity regarding that, correct?
Oh, absolutely.
Okay.
And you're correct. And I think that's, it's the hardest part of telecommuting is that every position is not a fit for
Right.
telecommuting.
That's what's
And in some departments, I think that has caused some unhappiness with some employees who can't, and they see other employees who are able to do it. And as you stated, Councilmember Gregory, you're absolutely right. People love it. I mean, employees like to do it. And it's unfortunate when you have someone who wants to, but they can't just by the nature of their job. But there may be workarounds. There may be maybe they could do it a few days a week. Maybe they could do it one day a week. Maybe they could flex their hours where they could work some hours from home and some hours in the office. I mean, I think that every department's going to have to figure out, because our operations are so diverse, as you know, I think every department's going to have to kind of figure out what works for them. I mean, the way I was envisioning and approaching it was, I was going to ask Tracy McKee, who, I don't know if you know this, but we have department head meetings once a month that she has. They're called ACE team meetings. And there's an agenda for every meeting, and we can take topics and all the department heads can weigh in on them and discuss it. And, you can get different points of view. And I think they're very helpful. But so I was thinking that the next one we have, I would ask Tracy to put that on the agenda and just kind of open it up. I'd like to get a better feel for how departments are, what their experience has been, and if they have any concerns going forward. Everyone who is telecommuting now has signed the telecommuting agreement. So we have a signed agreement on file for everyone who's doing it. So everyone understands what they should be doing and how it's working. But I would also like to just add that one thing that hampers us a little bit is, as you know, I think you probably know, we don't have an electronic timekeeping system. We're still using paper timesheets. It would, that it would help, if we, and maybe there's something out there other than going to a full scale Chronos timekeeping system that would help in tracking time, because of course that's always a concern when someone's working from home, because with non-exempt employees, you have to be very careful. You have to pay them for time worked. So I just want to make sure we have some good controls in place, and there may be some products or some way of doing it that I'm not aware of. I'm not an IT expert, but maybe the IT department can help us with that, because I don't really see us getting, a several $1 million payroll timekeeping system in the next year or so. Anyway, I just think that collaboratively, I think there's a lot of things we could do to make this work, and to make it better.
Okay,
I
Madam
just want
Chair.
to say for the record, for our fellow committee members, Councilmember Gregory and I supported that timekeeping system for the 2019 budget. Did we not?
But just one more question. As you're discussing all of these kind of administrative decisions, would you also put into the mix flex time? Because again, I think the city needs to get into the 21st century. Flex time is also a saving. I mean, it helps with traffic. It helps with a number of things. And I think that the city should start considering these kinds of approaches and get into the 21st century as quickly as possible. Because when you think about it, if you do telework, we don't need as much space as we're renting.
Right.
Okay, there are a number of things that could affect us in a very positive way. If we do the telecommuting and if we do flex time.
No,
I
I
agree.
agree. I agree with you, sir. And actually, I think some departments are already have some version of flex time. I know my department, we've been doing flex time now for a while, because what I have found is some people are morning people and some people are not. Some people do their best work at different times of the day. And if your organization allows for people to come in a little later, who like to sleep maybe a little later and work later, or people who like to come in very early and leave a little bit early. Maybe that helps them with their child care. They can pick up their children because they're leaving a little early. For my office, having someone here at 7:30, maybe working till 6 or even 7, that just expands my area of time that someone's here and available if the department needs someone. So I have people coming in my office different times of the day because it works for us. Again, I realize every department's a little different, but I do think that some departments are, kind of trying to be more open-minded about flex time, but I certainly will include that in our discussion and kind of talk to departments about what their feelings are. And try to gauge how much of that we have now, how many departments are actually using flex time.
Thank you.
Oh, great. And I hope I'm not cutting this conversation off too prematurely. Why don't we go ahead and take our vote then that we would like to see a permanent policy in place to the liking of the department heads and the HR and the mayor. And hopefully we'll hear it reported back to us. And if we can include flex time as an official part of that same policy, or develop a little, flexible flex time policy that doesn't even really need to be in writing, then we're all in favor of that too. So,
For their work week.
all in favor?
Aye.
Aye. Great, because now we have.
Madam Chair, who is the motion and second on that?
Go ahead.
I think that Councilman Shealy.
Yeah.
Yeah, I thought it was
you.
Sheila and Del Chapo, but
That's fine. Yeah.
Thank you.
thanks. So the third, and as Ms. Alterman's been truthful to say that, the hardest recommendation to consider in the COVID budgeting world that we're in right now is taking up the implementation of the council's recommendation to the Human Resources Committee last year that we study family life leave policies and come up with a way that we could recommend to the full council to begin to implement a paid leave policy. And I hope you all had a chance to look at the one-page document that Ryan Landry was great to work out with Ms. Alterman over the last earlier in the year, and it is an incremental approach. I do think that we should discuss it seriously because the budget is going to be going forward. This will probably be our last meeting before the ad hoc committee, budget committee, puts the full set of parameters to the overall budget. So I doubt if we'll have a chance to have another bite at this apple. And I would entertain a motion to consider this recommendation from the Women's Commission, and then we can discuss it and potentially amend it, or however you would like to deal with it, to put it forward to the budget committee.
So moved.
Second.
Okay, great. Thank you. So who wants to weigh in on how they're thinking about the recommendation we should be making, if any?
I like this incremental approach. I think it's easier to digest, especially in light of the hardline decisions that we're going to have to make coming up over the next few weeks. We put it there and council says yes or no to it. So what's the harm in putting it there and fighting for it? And, the votes will shake out how they shake out. And I think it's much easier when you're saying we're going to do, step like a phased approach, then we've got to go all in right now. I think it's a very fair compromise.
I like the idea and I like the incremental thing. I worry about the timing right now. We don't know what the future is going to hold. And I'm a little concerned about, even with the incremental, putting this out at this time. I'm just worried about the timing and all the decisions. We don't know when we're coming out of this situation. We don't know if this is going to last years. We don't, I'm just very concerned about the timing. I like it. I would be for it if we weren't in the situation that we're in. But I'm just very concerned about the timing because we don't know what the future holds right now.
Thank you.
Okay, so this is Amy. I just want to say I'm
Ms.
not
Martin.
sure the incremental will work right, honestly, doing it 6 months to 6 months. I mean, it's hard for us to implement anything that way, and especially Heather and Kay can help me out with this with leave and things like that, how difficult that makes it for us to do it that way. So I don't think that every 6 months will actually work for us.
Okay.
And the other part is the budget. And so, council could vote for it for sure, but you're going to make the budget that much harder for us in 2021 to balance it. And also you have to remember our hiring freeze is also going to go through 2021. We will have no option. And having more staff out when we're already very, very lean, which you all know we run very, very lean, I feel will put a very big hardship on our departments and our department heads, and that we'll probably lose more people because we're going to work them too hard. I just don't know that 2021 is a year that we can start this.
And just, this is Kay. I mean, just to follow up with what Amy's saying, she's right. I mean, the paternity leave would be FMLA leave, and to try to administer FMLA that's, has different parameters during the same calendar year would be problematic for us. So we would, whatever the city decides to do, we want it to be, calendar year, because that's how our budget year works. And that's how, as far as tracking it, it would just make it extremely difficult for us to do it the way it's laid out. And while, we do support, certainly paternity leave, I love, I know that there's only one municipality in South Carolina that actually provides this now. I certainly love being able to say the city of Charleston is the only municipality in the state that offer that we actually pay for all of our employees to have short-term disability. We are the only one, including Rock Hill. They don't offer that. We pay $280,000 a year for our employees to have it. So believe me, I love being able to add anything to our benefit package to make working for the city more attractive. But I'm also a little concerned because, and I don't know as far as how it's laid out. And I would prefer that when we do, or when it is taken to council, or you guys vote on it, I'm not sure about the 12 weeks. I just need to be honest with you that after that meeting at council, there were many department heads who expressed a concern to me that giving this much leave, especially the caregiver leave part of it, that is just really very open-ended, and it's very, very different than what other organizations who do offer leave, because even the federal government, they're starting their paternity leave October 1, but they're not offering any caregiver leave. So, and we couldn't find anybody in the country that's offering 12 weeks. And I know that we're saying we won't go offer that until 2023, but that's a very, very rich benefit that really no one else is doing. And a lot of the department has had some concern about how that would affect their operations. So I would like, before we, get to that level where we're talking about giving our employees that much paid leave in addition to the sick leave, the annual leave, and all the other leave they already have, I I just think that's another thing that perhaps we should have some discussion with department heads about to see kind of how they feel, because I know that no matter what, we're going to expect them to do their jobs and run their departments. So, yes, sir.
Okay, I mean,
I'm
yeah, I'm sorry. I'm just saying, in all due respect, I think it's very clear what council voted on. And, you know, as a result of that, you know, I understand the problems that it might, but I think much of what you're saying was also taken into consideration. We didn't do this blindly. We clearly understood that it might raise some issues with respect to management. But I think that, you know, if council has voted on it, I think that what we need to do now is to figure out how we can make it work. The timing is something different, but I do think that council has already voted to do it, and I think that we need to honor it, particularly as a committee, because the body of the whole voted for it, and I think it was unanimous. So I just don't want us to start backtracking on this. The when is another question, but I think the council was pretty clear that it was something that they wanted to happen.
I understand, sir, and I do appreciate that. I would like for department heads to, I don't know, feel better about it, feel like they at least had a voice in this, since they're the ones who are going to be tasked with keeping their departments running once this is implemented. I'm not saying we shouldn't do it or should do it, but again, I know at least 11 department heads had expressed some concern to me that they thought this would be detrimental to their operation. So if we could just even just have some discussion with them, I'm just suggesting it.
That's fair enough, but once we start talking telework, flex work, there's a lot of things that they're going to have to really deal with as managers. I mean, I had to deal with it as a manager, and I really didn't like teleworking on some of those kinds of things, but you just have to deal with it if it's a mandate from those above.
Why don't we, Councilmember Brady, you haven't had your say. Do you have something you would like to contribute?
I mean, I do like the phased-in approach, just because it spreads out some of the budget pain over a couple of years. But I do agree with Councilmember Shealy on, I don't know perception timing wise that it's the best time necessarily to implement it, you know, maybe holding off a year and re-examining coming the next budget year. Because I just think it's bad to, you know, have the deficit that we currently kind of have, and we're trying not to lay off employees, so then going into the next year and trying to provide a new benefit and figuring out how we're going to fund it. And I don't know that I can, and I agree, you know, I really want this to happen because I think it's a moral imperative. You know, there's only 2 countries in the world that don't provide paid maternity leave at the national level, and that's the United States and Papua New Guinea. And so I think for us to show the leadership, if our state government's not going to do it, you know, just like a lot of the stuff going on in the COVID crisis that's getting shoved down to municipal government, you know, I think this is something that we definitely should offer, as I said, as a moral imperative, but I just don't know that the timing is right now for us to try and implement it.
Well, I have I would like to deal with the, what I consider a very valid comment and constructive critique of the way that we've divided this up across a calendar year into the 2 different 6-month segments. I do respect having had to be in charge of implementation, things like this, or ongoing systems that would have the complications that they're pointing out to us. So could we talk about that for a minute? How about if we propose that in the incremental approach that we're looking at, that we would either agree to go only to the lower level for the first year, or we could split the difference between 4 weeks and 6 weeks on the maternity paternal side. So basically we would, you know, have a 5-week maternity paternity benefit and a 3-week caregiver benefit that we would propose as the the opening year of an increment and then keep on going like that. Can we agree that respecting the requests of both our HR and our finance office makes sense to make it only one set of weeks every year? For an entire year?
That was going to be my question, is rather than it being every 6 months, if we did the first year, it's the 4 weeks, and then we would consider the second year going to the next set. If that made things easier, I appreciate what Amy said. That's not something that would have crossed my mind of, those hiccups and trying to change things midstream. So I appreciate that and can understand that.
I mean, when you think a pregnancy lasts for, 9 months, and so you can start out putting in for leave and then graduate. So
Can I ask a question? This is Amy.
Yes.
So if we say, we'll postpone until 2022 the implementation of this, do we really need to say the number of weeks that we start out with? Because you don't know how long this is going to last, the financial impact of this is going to be. And maybe in 22 we bounce back and we're good, but why do we have to decide on the number of weeks right now that we would implement, is my question.
Well, how would we put it forward as a budget proposition if we don't have?
Well, then I would suggest in 2022, depending on how the budget is, that you start at the 2 weeks. And then if we can do more that year, then we'll do more, but start low so that, we're not getting ourselves into a bind.
So what you're suggesting, Ms. Wharton, for everybody to be clear, is that we not even propose this for next year at all, that we.
That's what I'm
saying. 2021.
We would need to hold it off until 22 because 21 is looking pretty abysmal.
Okay.
I guess I would ask the committee, is that a decision that we should make as a segment of council engaged in human resources support mission, or should we put that forward to the full, the budget committee and then the full council to make that kind of timing decision?
I feel as though
Councilmember Shealy.
I think you have to push it to all of them.
I don't think we should push this forward right now. I really don't. I think the timing's wrong right now. And I think we're only causing ourselves some problems if we try to do this. So,
But sir, what I'm asking is that a decision for the Human Resources Committee to make, or should we put it forward to the full council or the budget committee, who will recommend a complete budget, pretty much up or down to the council? The council has a chance to amend it, obviously, but by the time it leaves the budget committee, it's a budget that we want to vote yes or no to, without.
Did you not report out of the HR committee that the city's committed to doing this, but we've decided to defer discussions of this for a year because of our budgetary issues?
Yes.
That's an option.
That's the option.
Brady, Councilmember Brady.
I was just going to say, if we'd like a motion, I would like to make one that we were to Ms. Wharton's point, that we report out that we're in favor of this, but that we're going to table discussion on this until, I would ask for 6 months into the budget year. So next June, July, somewhere in there. And let's see how the budget's kind of looking as we start going into budget season. And then let's offer forward a recommendation to the ad hoc committee at that point in time.
Yeah, so it could be at the next year's HR committee meeting.
That was a motion.
Second the motion.
All right, so the motion is from Councilmember Brady, seconded by Gregory, that rather than put any document in front of the current year, the 2021 budget committee that's planning for the 2021 budget year, that we take a vote that will defer that submission until the middle of 2021 to be considered for the FY 2022 year.
That's correct.
Is there a discussion about that? All right. All in favor?
Aye.
Aye.
All opposed? One opposed? Everyone in favor?
Yes.
Okay. Looked like you raised your hand twice, Councilmember Gregory, so I wanted to make sure.
I'm just tired. It's been 2 hours.
I would make one follow-up suggestion, and I'm happy to do that as the chairman of this committee, that because this was voted on at the full council, as Councilmember Gregory was, correct to remind us, I do think that we should give an answer to the current council for this coming year. So we need to have a memo that would go, I guess, under council communications or something like that.
And I think that becomes part of your report to council, the HR committee.
Your report out.
Okay, all right.
We're doing it.
Okay, that makes sense.
All right.
On
All
Councilman
right, well, yes, go ahead, Ms. Press.
just to close out with just one thing, since we're not going to be, I guess, considering this for next year because of, the budget issues we have, but I just wanted to remind you all, because I don't know, since you guys don't accrue annual leave, you don't accrue sick leave, and so I just wanted to remind everyone, I just did some quick calculations because I just didn't want you to think that our employees don't have any leave available to them. I kind of went right in the middle. You accrue more the longer you're here in 5-year increments. But so I just kind of took a slice out of the middle. If employees been here for 10 years, between the annual leave they accrue, the sick leave they accrue, the paid holiday time, that's 2 months, 2 full months of paid leave that they have access to. In addition to short-term disability does cover maternity, which we pay for, which we make sure every employee has. So I just want you guys to understand that, our employees do have leave available to them. They do have short-term disability. So I'm not saying that we shouldn't enhance that. I'm not arguing that we shouldn't have a family leave policy and include additional leave, additional maternity, paternity leave. But I just don't want you to think that our employees are not without anything, because they do have a good benefit package.
Thank you very much. I'm so old that I used to watch all those corny game shows with my grandmother, and they always had the consolation prize. Get queen for a day. So consolation prize.
A washing machine. Take out washing machines.
I'm sorry. Yeah. I used to watch those shows, Councilman Gregory. You were out running around. I know all about that. So now we have old business. Is there any old business to come before the Ms. Alterman?
I really appreciate the discussion. I've learned a lot. We'll take it back to the commission. May I be excused?
Please do. Thank you so much for coming.
You.
We really appreciate
Absolutely.
it. You have to delete your staff badge in order to do that. So old business. Is there any old business anyone wants to bring up from our minutes last time, or anything else?
Well, 5 hours on this thing's a long time.
Other business? Any other business that doesn't come under the category of new or old? I don't know what that is, but all right, then I think we'll be adjourning the meeting, and thank you so much. And I'm sorry that it's a long time, but I think we accomplished a lot today. So I really appreciate it.
Thank you.
Have a great night.
Thanks, y'all.
Okay, bye-bye.
Bye.